Amesh, I began the show by suggesting that the lift in the market 2 days in a row, there's this, and it's one single news article that says Omicron tilts towards being a cold. What say you about the present research on Omicron?
It would be great if it tilts towards being a cold, but I don't think we can say that with certainty yet. I think there's a possibility that that may be the case based on some of the early case series that are coming from South Africa, that we're not seeing as many people being hospitalized, not as many people needing ICU beds or needing oxygen, and a lot of people getting picked up incidentally when they're in the hospital for other reasons. That's all reassuring. But we need more data to be able to say that with certainty. And we also need to see what happens when we extrapolate South Africa's experience to countries that are older, like the US. And it's also the case that the US has more vaccination. So this would be a great thing. I think all of us are cautiously optimistic. It's interesting because it all seems to be converging upon this consensus, and that's a good thing because we're not seeing outliers of severe disease yet. I suspect we will see it, but hopefully this is kind of the step that the virus takes to become something that we deal with more frequently on an annual basis, that has the ability to get around our immunity but not make us too sick. But I think we still have to wait for a bit more time.
What is your waiting to the calendar, to the fact that there are waves to the autumn and into winter, whether it's a cold, the flu that amateurs would call it? What's the weighting of the seasonality versus all our other fears?
Well, I do think that coronaviruses are going to ultimately end up becoming seasonal because all of the other ones do. This one just takes some time to get to seasonality because there's not enough immunity in the population. But I do think we will see intensification of spread when it gets colder, when people move indoors, and when spread of the virus is more efficient. It's just going to take some time to see that complete stark seasonality. Right now we do see some seasonality, but there's still transmission going on in the summer because there's too many people that were not immune.
Given what we know about Omicron and what it can do getting around certain immunizations, whether it's vaccinated individuals or people who've been previously infected, what does it mean to be fully vaccinated? Does it mean a booster shot as well?
Well, I think you have to remember that vaccines are not all or nothing. It's not an on and off switch. There's a spectrum of protection that they provide. And even if Omicron is able to get around some of the immunity, which is likely the case, it's not able to get around what matters: protection against serious disease, hospitalization, and death. And when you think about boosters, to me, the threshold has always been preventing serious illness, hospitalization, and death. And that's why I'm somebody who thinks boosters belong to people that are above the age of 65, high-risk conditions, those who got the J&J vaccine. For the healthy population, it's a little bit unclear whether they're needed or not, even though the CDC updated their recommendations, and there is some controversy in the field. There may be a need with Omicron to make an Omicron-specific booster, and then that's a little bit different. But these first-generation boosters, I think in a healthy population, you're just really pushing off a breakthrough infection sometime in the future. You're not really giving a great amount of protection in terms of what it actually gives you. But if you're older or have a high-risk condition, yes, there's definitely clear benefits there.
Dr. Adalja, before we let you go, I'd love you to weigh in on the mandate in New York City now that all private sector employees get vaccinated. Is this the course of travel that you expect, not only in New York City, but around the country and around the world?
I think it's going to be certain cities that try and do this. It's interesting because New York City already has one of the highest vaccination rates in the country. It would be great if that was going on in parts of the South where the vaccination rates are low. But what we'll find probably is some states that are already highly vaccinated are going to become more boosted and more highly vaccinated, while the rest of the country kind of languishes at that lower rate of vaccination, like West Virginia, 41% fully vaccinated. So I think we're kind of still in that two-track pandemic. But I think that because the OSHA mandate predictably got tied up in courts, you're going to see local municipalities and states try the same thing.